before I show you how you wear your facial properly, I want to tell you something about facial first. So now guys, the facial is your secondary protection against the droplets. So but the default protection is your face mask. That's why the facial is put on top of the face mask. You know guys that this facial is only can use for those example, they have difficulty of breathing for using a face mask for a prolonged period of time, and then those children aged 12 years old and below, because they are difficult to breathe when they are using the face mask, especially the infants and the toddlers. So you can use the facial instead. And you know guys, but it's not just you wear the facial, but you have to remember that wearing it wrongly can get you into danger. So guys, stay tuned and watch out, because I want to show you how you wear your facial properly. So guys, before you wear your facial, you have to wear your face mask first. And you remember that the blue side is outside and the white one is inside. So press this. Okay, that's good. And you have to wear your facial first. This is a gutterized, this is a foamy, and this is you can replace it whenever it's stuttered, and of course the gutter as well. But before guys, remember that you have to take the covering here in front. This one you have to take out first, right? And if you already take out, you have to wear like this, and you have to adjust this and make sure it covers your forehead, and your mouth is very important. Yeah, make sure it's covering, and the foamy thing here is covering your forehead. You see, there's no skin coming out. That's the proper way of wearing your facial. And if you want to rest your face from wearing a face mask, so you can wear your facial instead when you're eating and drinking. So guys, must be important. Then if this one is tattered already, you can change the foamy inside, and then you can wash this transparent seal. So guys, thank you for watching and be safe.
Misinformation about the correct way to wear disposable face masks has spread on Facebook and WhatsApp following the global outbreak of a new strain of coronavirus. The posts were shared hundreds of times by Facebook users based in Sri Lanka and the Philippines. The post claims to demonstrate the correct way to wear a disposable blue and white face mask. It was published on Facebook on January 22, 2020, and has been shared more than 890 times. The post claims that the colored side of the mask should be visible if the wearer is infected, while the white side should be visible if the wearer is not sick. The post claims this will enable the mask's filter to effectively stop the transmission of germs. A similar claim was made alongside an identical image here, here, and here on Facebook. The post gained traction after people across China and in neighboring nations began wearing face masks as a precaution against the new strain of coronavirus which originated in the Chinese city of Wuhan. The virus has so far killed at least 106 people, AFP reported. But the image shared in the posts is misleading. Health experts have stressed that the only correct way to wear this type of disposable mask with the colored side visible and white side turned towards the wearer's face. Dr. Seto Wing Hong, the co-director of the World Health Organization Collaborating Center for Infectious Disease Epidemiology and Control, and a professor at the University of Hong Kong, demonstrated the proper use of face masks here. You got to wear it like this: the blue on the outside, the white on the inside. Dr. Seto notes. Dr. Seto explains that the colored part is worn on the outside because it is waterproof and prevents moisture from entering. The white side, Seto adds, is worn on the inside because it is absorbent and prevents germs from being released to the atmosphere. In Sri Lanka, which confirmed its first case of coronavirus on January 28, 2020, the Health Promotion Bureau also maintains that correctly wearing a face mask is vital to mitigating the spread of airborne viruses. There is only one way to wear a disposable surgical mask the right way. The blue or colored part must be worn on the outside and the white panel should be worn on the inside. An agency spokesperson told AFP by phone on January 28, 2020. The chief matron of the Colombo National Hospital, Pushpa Ramyani Zoisa, also addressed the misleading claims about face masks on Facebook here. A screenshot of the post which shows two women with the blue side of their masks visible. The post's Sinhala language caption translates to English as "Wear the face masks properly. Although various opinions are being shared, this is how you should wear a face mask as per experts." When wearing face masks in order to protect oneself from infections, make sure the white part is facing the face and the blue panel is facing out.
We hear the phrase social distancing a lot these days with the spread of the new coronavirus, and you may be wondering, how does it help? When a person with the coronavirus coughs or sneezes, they spread the virus through droplets from their nose and mouth. It's thought that these droplets can remain in the air for a few hours and also land on other people and surfaces. You primarily catch the virus by breathing in these droplets or by touching a surface that has the virus on it, and then touching your mouth or nose. Social distancing helps slow down the spread. That means you avoid shaking hands, avoid gathering in groups, stay away from surfaces many people touch, and keep your distance from people outside of your household. A 6-foot distance is recommended. Why is this important? Our healthcare system can only handle a certain number of sick patients at one time. That's this flat line, the capacity of the U.S. health system. The red curve shows what will happen if we don't do anything. This infection will quickly spread to a lot of people. Our hospitals won't be able to care for so many sick patients at once. They won't be able to keep up. With social distancing and good hygiene, we can help slow down the spread of the disease and reduce the number of people who get sick. This gives our hospitals a fighting chance of taking care of everyone who needs it. That's the blue curve. That's what we mean by flattening the curve. We slow down the spread of the disease and we save lives. One of the most effective ways to flatten this curve is to practice social distancing. So what does this mean for your everyday life? Some of the ways in which we connect with family and friends will have to be put on hold for now, like parties, lunch dates, group classes, or play dates for our kids. Don't share objects such as toys, handshakes, or hug anyone outside of your household. You may think it's okay to connect with just that one friend, but it can take up to 2 weeks for symptoms of the coronavirus to show, so it can spread before you even realize you have it. That's how just that one connection can continue to spread the coronavirus and make the need for social distancing last even longer. But there are things you can do. Embrace technology. Connect online with friends and family through video calls, texting, and social media. Go for a walk or run. Work in your garden, workshop, or kitchen. Knock off things on your to-do list. Try a podcast, read a book, try a new hobby. Enjoy some family time. If you do need to leave your home, Try and limit the time you spend in public spaces like the grocery store. And keep a 6-foot distance between you and non-family members. Humans are naturally social, and social distancing may seem unnatural at first, but it's important. Finding new ways to stay connected from a distance will give us all a chance to stop the spread of the coronavirus.